Good morning. Call the meeting of the Community Health and Safety Committee to order of the Kent County Board of Commissioners. It's 8:33 in the morning. We have a quorum present. I know Commissioner Merchant's running a few minutes late, but just want to get started. Respect everybody's time this morning. We'll move on to item number 2 on the agenda, public comment. Anybody from the public wishing to address the committee this morning, please come forward, state your name and address, and you have 3 minutes. Good morning.
How you doing? I'm D. Jones, at 910 The Orchards. Just a couple days ago, I drove to the city of Lansing because there were 2 House bills, House Bill 4510 and House Bill 4511. Those are digital asset bills. I am in support of those bills, and I did speak on House Bill 4511, which allows us to have cryptocurrency and not have the states ban it, which they shouldn't, because, or the city or county ban utilization of cryptocurrency because it can be used for social good, but it also can be used for bad. But I spoke on these bills because, as you guys know, I am a featured creator on the decentralized streaming platform. They paid me $1,000 in USDC to actually just stream, voice my opinion, do anything I really like to on stream. But that token utility, as the headquarters of this company is based in Dubai, where they actually printed the first building in Dubai, and they're actually printing homes, and they're actually starting to innovate, invest heavily into cryptocurrencies and digital assets instead of oil. And so I asked the CEO of Party.com to add 3D printing construction, and 3D finance, and 3D printing buildings into the utilization of this coin, because with my advocacy since 2018, I've been able to successfully advocate for our city government to actually 3D print homes. So it's crazy that I've been advocating since 2018, but today they'll be passing their consolidated housing plan with 3D printing, and the policy and the plan to actually innovatively 3D print houses. As you guys know, I've been speaking about the revolving loan fund and actually getting funding, and they'll be having available opportunities for people to put requests for proposals to actually get funding from the city throughout the state and potentially the federal government to actually go about this. So we actually have a feasible business plan. I am continuously speaking to the neighborhood organization, the West Grand Neighborhood Organization, on 3D printing. I was just on the agenda, but I have to continuously educate them, so I have to go before land use, and then I'll be back on the agenda in January. But the good thing is the policy will be passed, and the community development director will give me a letter that I can give to banks and other people to let them know that the city is investing to it, so we can actually solve the housing issue. Not going to say that we're going to solve the global United Nations housing issue, which we need 1.4 billion houses, but I know that we can also tokenize this real estate in 3D printing houses. And I look to speak to the fiscal directors, because the chair of the Economic Competitiveness Committee really liked it. And I do like that we do have a Republican board there that actually supports digital assets, because this is actually needed to change the Federal Reserve banking system, but also free people and have some fiscal legislative policy that benefits the Democratic Party and the Republican Party bipartisanly. So thank you for this. I appreciate it.
Thank you. Anybody else from the public wishing to address the committee? Okay. Seeing none, we'll move on to item number 3, which is approval of minutes from the November 25th, 2025 meeting. I would entertain a motion moved by Commissioner Budziak, supported by Commissioner LeGrand. All those in favor of approval of the minutes, say aye. Aye. Any opposed, say nay. The minutes are approved. Item number 4 on the agenda is our special orders of business. We have 2 presentations this morning. We will start first with the Kent County Domestic Violence Action Network. We have some guests here with us, and I know they're waiting for one person who's stuck in traffic as well. Did you guys want to come forward and get started? Okay. I know we have Micah Johnson, who's the director. I know we have the Honorable Judge Sturkenberg from the 62B District Court. And I'll let you introduce the other guests when you get here. So good morning. Thanks for being here.
Thank you. Good morning, Chair Hildenbrand, members of the committee. My name's Mike, as you learned, my name's Micah Johnston. I'm the director of the Domestic Violence Action Network, or DVAN. And I'm glad to be joined today by Judge Amanda Sturkenberg, who is from the 62B Domestic Violence Court, as well as Mr. Stevenson, who's on his way. He got stuck in that accident, but hopefully he'll be here before we finish. I'll figure it out. All right. Today, we're here to just basically highlight how DVAN is transforming how the county responds to domestic violence through collaboration, coordinated services, and the successful launch of several key initiatives, including increased support for survivor advocacy, a new high-risk team, as well as the DV Corp program. Skip ahead a little bit. Foundational to our impact is our community's decades-long commitment to fostering a coordinated response to domestic violence. So our work has gone on long before DVAN. In 1985, the DV Coordinated Community Response Team formed, and so for decades it's been promoting interagency cooperation to promote systems change. However, historically there was limited funding, and so it was hard to start new initiatives. 2021 was a tragic year. There were 6 DV-related homicides in the county within a few months. And so this moment really made us tragically aware that we needed a more unified and effective structure for responding to domestic violence. And this moment of tragedy and recognition met a really unprecedented opportunity in 2022, as you all know, when the county agreed to fund $4 million to formalize the DV-CCRT into DVAN, which has allowed us to expand collaboration and launch new initiatives. Before I share an update on our initiatives, I think it's important to just take a moment and realize the scope of the domestic violence problem in Kent County. Annually, law enforcement agencies across the county respond to over 2,500 domestic violence incidents. And we know this is only probably about half of the total because most victims don't call law enforcement. One individual agency of several working in the county has reported that between January and September of this year, they received 3,000 crisis contacts related to domestic violence with over 2,300 unique individuals. And so these numbers don't even come close to painting the full picture, but I think they show us that domestic violence doesn't affect tens of people, it doesn't affect hundreds of people, it affects thousands of our family, friends, and neighbors across the county. And so DV requires a broad-based and collective response, and that's what DVAN is aspiring to be. We're now a network of 60 organizations and 300 individuals who are working together to reduce gaps that put victims at risk and also make it harder for offenders to change their behavior. DVAN aggregates the compassion and the leadership of our community into focused, life-changing impact. So today, I just want to highlight 3 of our initiatives. As I mentioned, increased advocacy for survivors, our DV high-risk team, and then the DV Corp program. DVAN funds 3 mobile advocates in our community through partnerships with Puertas Abiertas and Safe Haven Ministries. This model allows us to remove barriers. The advocates actually go and meet with people where they feel safest. It avoids barriers such as that are caused by transportation, childcare needs, and the fear of being seen seeking help. And they report to us that this depth of support would not be possible without funding sources like DVAN. I also want to highlight this high-risk team that I keep talking about. So in partnership with the Grand Rapids Police Department, DVAN launched a domestic violence high-risk team on December 1st of this year. The team is piloting operation in Grand Rapids, and we hope to expand across the county as new law enforcement agencies come on board. The high-risk team model follows a national gold standard for domestic violence homicide prevention developed by the Geiger Institute, and it has 4 key components. Early detection. So DVAN has trained the entire GRPD police force, and officers now use the evidence-based danger assessment for law enforcement on every call so that they can identify individuals who are at high risk of domestic violence homicide. Number 2, supportive services and safety. The high-risk victims who are identified on scene are immediately connected to advocates at Safe Haven and YWCA so that they can get timely safety planning and shelter. Coordinated management. The high-risk team meets regularly and is developing processes to coordinate between advocates, law enforcement, and prosecutors to make sure that we keep track of dangerous offenders. And then number 4, offender accountability. DVAN has trained judges, prosecutors, on the DALE and the results of the DALE so that they can support stricter monitoring of high-risk offenders through tethers, PPOs, and stricter bond conditions. The HRT launch signifies several key milestones. I think it's important to note this is the first high-risk team that is active in the state of Michigan. It shows true community collaboration, which is like the core of what DVAN is. The current pilot phase is co-funded by a GRPD grant along with DVAN funding and relies on the support of critical community partners. This kind of work can't happen with one agency. We all have to work together. We're also proud that our agency with GRPD helped develop a new multi-agency protocol and developed a new police policy. We're told by our partners that in some communities this can take years, but because of DVAN's collaboration, we did it in a few months. Finally, the Geiger Institute estimates that nationally, 30% of law enforcement DV calls are high risk. And so if you extrapolate that to Kent County, we can expect as many as 750 per year. And basically, the key to this program is this tool will help us predict those high-risk cases, and if we can predict them, we can prevent them. And then I want to also just introduce the domestic violence court program before Judge Sturkenberg comes. And the court program was launched in July of 2024 at the 61st and 62B district courts. Participants go through a structured 4-phase program that includes a certified 52-week battering intervention program, or BIP. It has regular judicial reviews, substance testing, and strict no-contact orders. The goals are to promote efficiency and to intervene early, while holding offenders accountable and reducing repeat offenses, while kind of central to everything, supporting victim safety. There are 4 key interventions: holistic case management, the 52-week battering intervention program, which is really important because it focuses on the accountability for violence committed and changing belief systems, not simply therapy or dealing with emotional systems. It's really about behavior change. We also fund specialized advocacy through 2 dedicated victim advocates in the Kent County's Victim Witness Unit that ensure survivors have safety planning, resources, and a voice in the judicial process. And we have a multidisciplinary care team that meets regularly to coordinate decisions, always centering survivor safety and behavior change for the participant. I'm going to go quickly through this so I can pass it on to the experts. But the court has been a success so far. We're expecting our first graduates early next year. And in addition to just changing how we respond to these cases, it also has the potential to help us save money in terms of bookings. So some of my colleagues in DVAN work closely with the Just GR research work that's going on with the Aspen Institute and Corewell Health. And they've done some work with the county jail and identified that the county spends $1 million a year on DV bookings. And so our hope is that through this court, not only will we be able to change lives, but we'll be able to reduce these repeat offenses and drastically bring down those costs as they relate to bookings. And so with that, I'll turn it over to you, Judge Sturkenberg.
Great, thank you for that presentation. Good morning, Judge Sturkenberg. Thank you for being here this morning.
Well, thank you for having me, and thank you, Micah. I have been I'm not as tall. I have been so pleased to be a part of this DV court endeavor. Micah did a really good job of talking about the court model, and he asked me to talk with you about my perspective as a judge leading this specialty problem-solving court. Creating a holistic and individualized plan for each offender to tackle the underlying causes of criminal behavior is the recipe for success in these challenging cases. When we tackle intimate partner violence, we are not just taking on one person with one problem. These cases are usually the product of generational patterns. Sometimes we are talking about learned and therefore normalized violence. Sometimes we're talking about addiction, financial need, childhood trauma. Sometimes both partners are coming from life experiences that impacted them so negatively that they have been left with very few of the skills necessary to interact with the world in what we would consider a normal way. The treatment court model is designed not only to give the participants those skills, but to build confidence. Confidence to use those skills to make their day-to-day interactions more healthy and productive. Quite frankly, a lot of our participants come in with a chip on their shoulder. They believe the world, and often the justice system, has treated them unfairly. Many come in with defensive attitudes and negative feelings. Judicial involvement, that's me, in the treatment court confronts these grievances head-on. When you don't feel like you can trust the person who is speaking to you, you are not going to buy into what they are offering. And because the judge, in the usual course of a case, is only reactive, handing down a sentence with very little other involvement, to defendants, we are usually the symbol of everything that has gone wrong up to that point. In our DV treatment court, I collaborate with our participants to build trust. In fact, they can't get away from me. It's true. In the first two phases, they are seeing me every 2 weeks. I get to know them. I get to know their past. I get to know their present. Research emphasizes that positive outcomes are more likely when participants perceive the judge as respectful, fair, attentive, and caring. And so that is what I strive for. The participants in our program are people just like you and me. Sometimes they've just had a harder road. So they get treated like people. And over time, they come to understand that the program is not just about punishment, and that when they work the program, the facilitators are rooting for them. Every member of the care team, that multidisciplinary care team that Micah mentioned, every member is rooting for their success. And when they know the black robe is invested in their success, it motivates change and it improves self-worth. And because of the generous ARPA grant that this program is built upon, the participants get the benefit of therapeutic intervention specifically and empirically proven to create lasting behavior change, and their costs are offset. Personally, I can tell you that every time I remember the name of a participant's pet, or I ask them about the trip that they were going to take that they were so excited about, or I applaud their achievement, no matter how big or how small, it builds that trust, and it paves the road to success. To have someone in authority in your corner is something that many people never experience. And it makes a huge difference to participants coming through our program. The 52-week batterer intervention program is a big ask. It's a lot of emotional, heavy lifting, and the schedule is demanding. The participants already have jobs and families, and some of them already have other court cases. It's hard, but the skills are so valuable. The continued judicial oversight, intensive case management, and therapeutic intervention together make this form of post-conviction supervision successful. And the measure of success is not just not catching a new case. It's transforming behavior and strengthening relationships. Here's what some of the participants in my court have said. I've learned through my BIP groups that others do care, and I can accept their support. I couldn't do that before. I did not trust others. Growing up in my family, there were traditional roles for a male and a female. I have learned that that is not an equal relationship, and I will not be controlling or demanding to my partner, and I will appreciate the work my partner does in the home to have a healthy relationship. I have never been this sane and level-headed before. I have learned it's how you react to being upset that matters. It's okay to have emotions. Those are quotes from active participants in the treatment court. But I'd like to put a face to the program. I'd like to introduce you to Mr. Rumiel Stevenson. Come on up. This gentleman was the first to enter the DV Court program in Kentwood, and we anticipate he will graduate in just a couple of months. He'd like to say a few words, and when he is done, if you have any questions, I'd be happy to answer them for you.
Good morning, Rumiel. Thanks for being here this morning. We appreciate it.
Good morning. Thank you guys for having me. I did prepare a letter today, so I'm going to go ahead and speak that. First of all, I'd like to thank everyone for allowing me to speak today. It's an honor to be chosen to do this. And I would also like to thank Judge Sturkenberg for believing in me and trusting me to speak. I just want to share with all of you today that this program has affected me personally. I feel as though as the early stages were rough. I was so upset with myself, I didn't recognize who I was. I was disgusted with me personally. I couldn't even look at myself in the mirror at times because I knew that that's not who I am, and nor the kind of man I want to be. I thought long and hard about my actions and how it affected the victim and their families, and how it also affected my family as well. I had instantly regretted what I had done and knew right away that something had to change. The DVAN program was exactly what I needed. It helped me discover the tools I needed to become a better human being, not only as a man, but also as a father, who would never want to see his little girl experience domestic violence. I dedicated myself to working the steps in this program, staying sober, doing my regular scheduled check-ins with Sharon, being heavily active in the court reviews, managing my time with routine schedule, and finding new ways to cope with my emotions in my therapy groups that I've attended. At first, I thought I wouldn't get anything from it, but my personal growth over the course of the year would suggest that it works as long as I apply myself. I've made tremendous amounts of progress in my life, personally and financially, using the skills I've learned to manage my thoughts and feelings, and also helping others from family to friends, and even strangers. I am currently working 2 jobs to keep myself free from alcohol and drugs. The program has definitely given me the tools to turn my life around, and I couldn't be more happier with the turnout. Like Judge Sturkenberg would always tell me, progress, not perfection. I truly believe that I would encourage this program to stay open and active to help others just like myself fix their lives. I am proof positive that this program really does work. Thank you for your time.
Thank you, Romeo. Yes. We regularly applaud within our DV Court review sessions because we want to positively encourage everyone. Hey, great job, man.
Thank you.
Great job. Thank you for sharing your story. Appreciate it.
And if there are any questions, I'm sure Micah and I would be happy to
Yeah.
entertain and
Great.
answer them.
Well, thank you all so much for the summary and the report, and thank you for the important work you're doing in the county. We can tell, you're personally invested, you're passionate about what you do, and it's really important work. And Rumiel, thank you for the courage to come up and share your story. We appreciate that very much, and keep up the great work. It sounds like you're on a better road and better path. So, Commissioners, any questions? We'll start with Commissioner Bujak.
Thank you, Chair. Micah, nice presentation, and Judge, thank you so much for your compassionate approach to the work that you do and treating people, the way they hope they could be treated by the system, and, building that relationship of trust. That's very difficult, I know. It's sad that we still have, domestic violence in our society, and it's my guess that unfortunately you'll be back here again next year giving us yet another report. Hopefully, that number is less than 2,500 next year, with the hard work that you're doing. It's sad that in our society there is societal ills, and our effort as elected officials through these programs is to try to help bring the financial aspects that are necessary to provide these programs. But I think somehow there needs to be a deeper dive into the root cause of all these social ill. And I don't think that government and money and programs can solve that problem. People are complicated, relationships are complicated. And I've said many times that individuals become partners through marriage or other ways. And there really is no like vetting or training for those individuals before they get involved in those relationships. So those relationships are dynamic, they're complicated, they're difficult, and people are under tremendous stress financially. They're under stress societally with pressures from social media and other things that affect them. And of course, the problems of substance abuse. And all those things combined create a cauldron of potential for, situations that escalate to the point where we have to send the Kent County Sheriffs out to deal with these. And I'm so glad that you're training the Kent County Sheriffs how to recognize and deal and de-escalate these situations so they don't get worse. We certainly don't want to see these domestic violence situations turn into homicide. That would be worst case scenario. So again, we applaud you for what you're doing and encourage you, and those who are using the program, Mr. Ramil, thank you for being here today and letting us know that the things that we're doing from where we sit here are actually effective. People are complicated, and the best we can do is continue to support these programs, and we thank you for doing that.
Thank you, and thank you for your support.
Well said, Commissioner Bujak. Commissioner Morales.
Thank you, Chair. My question is, I also want to second everything Wally said about what a great job you're doing. I really appreciate a holistic approach to most problem solving, so I really appreciate that. But I am curious about what exactly the battering intervention program is, and why is it called battering? That sounds kind of rough.
Yeah, I agree. I don't love the name. I don't love the name, but it is
Hey,
actually.
Judge, could you step up to the podium,
Sure,
please? Thank you.
Sure. I don't love the name Batterers Intervention Program either. It sounds awful. But it is actually a clinically recognized set of criteria. It is a curriculum that is built by, what is it?
It's certified, I know.
The certified, there is a certified BIP institute, and they create this curriculum, so it is a specific curriculum. They named it, the therapeutic interventionists named it, we didn't. We'd call it something else if we could. And so what that is weekly meetings in a group and sometimes individual setting with our therapeutic providers, and we have several. We work with the Men's Resource Center, we work with Sean Corbin's agency, he just changed the name of it.
Synergy Behavioral Health.
Synergy Behavioral Health. We work with a couple of other partners who are certified to provide that training. So those are therapists who then go above and beyond, get this additional certification to do this. And there's two versions of the Batterers Intervention Program. There's actually a 26-week model and a 52-week model. And over the years that this program has been evolving and has been available, and they've been studying the results of it, time and time again, the research has come back supporting that the 52-week is really necessary to see long-term behavior change. The 26-week model sometimes is successful for temporary change, but in order to create long-term change, the evidence suggests the 52-week model is what is necessary, and so that is why we built that right into this program. Yep.
Great, thank you. Commissioner Morse.
Thank you, Chair. So this is brought forth through the ARPA grant dollars, the $4 million grant dollars. What's the timeline of lifespan of those dollars, year after year? Like, when does the money run out?
This is a Micah question, but I do know the answer, but I'm going to let him speak to it.
So the funding was initially for 4 years. So technically, our current grant ends in December of 2026. We are hoping to do a no-cost extension, so we've been talking to the administrator's office about that, because we have had some savings, and so we hope to be able to stretch that into 2027. And right now, DVAN Steering Committee, which is made up of our core agencies and leaders in the community, is kind of thinking about how best to use that money. And I think, in a very basic level, we hope that money is going to buy us more time to kind of diversify our fundraising opportunities. So later today, we're going to meet as a court team to talk about grants that we can apply for and things like that.
Okay, that's like where I was
But-
going with it is
But
it?
there's never enough money, right?
Yeah,
And this is
for
like
sure.
long-term work.
Yeah.
And so, yeah, I mean, we're hoping to find champions and partners everywhere.
Okay, thank you.
Commissioner LeGrand.
Thank you, Chair. This has been a wonderful presentation. I really appreciate it as someone who was helping to decide those ARPA dollars and also someone who's been a big champion of all of our problem-solving courts. It's been wonderful to see this happen. I also happen to be part of a Just GR, so I know Rachel Verweiss and her work and how this is really unrolling in the community and what an impact it's making. So grateful that you're here. And thank you, Mr. Stevens, for being here and being brave enough to share your story, because it's what it's all about. You know, it's very easy to just throw someone in jail. This is so much harder, and it's so much more complex, and it's so much better for everyone. Everyone is so much better for the community, and I'm just really grateful to you for, you did a great job of showing us how complicated it is, how the agencies have to be involved, the law enforcement, but to avoid that recidivism, to avoid the escalations, and to prevent it hopefully from going on to another generation who's witnessing this. It's really just an amazing testament to your belief. And I know, Judge, that judges have to be very bought in on a problem-solving court to make it happen. So very grateful. I do have a question. I'm not just talking. Is this program available? I know we're talking about the 63rd District, but is it available to anyone in the county? Do you just have to qualify? It's not geographical at all, right?
I can answer that question.
Okay.
And I just wanted to underscore your point, right? Programs like this, problem-solving courts, are designed to stop the ripple effect. And domestic violence, make no mistake, is a generational problem. And so if we are able to change behavior that is then witnessed by the younger generations, by the extended parts of the family, then we really can have an impact that is much larger than one person. Like I said, it's not one person and just one problem. So thank you for pointing that out, because that is really at the heart of the work that we do in the problem-solving court. And then your question was, who is it available to? So first of all, it has to be someone who has been charged with a criminal offense that involves intimate partner violence. And then there are criteria that we have laid out with the cooperation of the prosecutor's office. So it must be certain charges, there must be certain criteria that case meets. And then there are some excluding factors like significant mental health concerns or things along those lines. But anyone who is charged with a qualifying offense in Kent County can come into the domestic violence court. If they are charged with and/or live in the city of Grand Rapids, then they are directed into the 61st District Court program, which is run by my colleague, Judge Jennifer Faber. And so in a very similar vein, but all judges are a little different, so she runs a court there. If you are charged with and/or live in a different geographical area of Kent County outside of 61st District Court in Grand Rapids, you will probably come to me. I mean, there can be some overlap depending upon what is most appropriate in that case-by-case basis. But I take transfer cases under the statute that is written for jurisdictional transfer of cases. So I accept cases out of the 63rd District Court, out of the 59th District Court, 62A District Court, and then also cases that have already been bound over because they are felonies to the 17th Circuit Court can also be transferred to me if those cases are determined to be appropriate.
Wonderful. Thank you. Thank you so much for being here.
You're welcome.
Great. Thanks again for being here and for all the important work you're doing in the county. We very much appreciate it. Okay, we're going to move on to item 4B on the agenda, another special order of business. We have the Network 180 Annual Report. With us is Bill Ward, the Executive Director of Network 180. Good morning, Bill. Thanks for being here this morning. We look forward to your presentation.
Good morning, Commissioners. As I was thinking about this last night before this presentation, I realized this is the 6th year in a row that I have appeared before you all. And over the last probably 3 to 4 years, we focused heavily on the crisis work that we're doing at Network 180. I want today to highlight some of the other things we're doing. We're going to talk about crisis work, but more importantly, there are other things that we're doing beyond. The mission of Network 180 is to serve adults with mental illness, kids with serious emotional disorders, individuals with intellectual and developmental disabilities, including autism and substance use disorder. So traditionally, we were the safety net for the county, but we have evolved and that because comes from a special designation that we received in 2013, which is we are now what's called a certified community behavioral health clinic, which means we can serve anyone that comes through our doors, no matter their insurance type, their income. But one of the biggest changes that we saw in 2023 was now we can serve veterans. For the longest time, if you were a veteran, you had to go to the VA to get your mental health services. Because we are a CCBHC now, we can actually serve veterans. So it's really exciting to talk about that. So what are CCBHC services? Well, it's designated from the federal government. It's a direct payment from the state of Michigan. So oftentimes you'll hear us talk about how we get our money from the Lakeshore Regional Entity. That is no longer the case as of this year, as of October 1. So every week we actually bill the state of Michigan, and then they pay us for the services that are classified under CCBHC. So that would be our access and screening. That would be our mobile crisis response. That includes our co-response with Grand Rapids PD. That includes our non-law enforcement response from the mobile crisis team at Network 180, as well as the coordination through the Sheriff's Department of our embedded clinician that's at dispatch right now. Traditional outpatient services, the Behavioral Health Crisis Center at Trinity Health is divided into two different services. One being the urgent care, that is a CCBHC, and then the secured side is treated almost like an inpatient. An inpatient is what we would bill the Lakeshore Regional Entity for. And then assertive community treatment, that is our most intensive services. Those are for individuals that oftentimes are not guilty by reason of insanity, but they've been released back into the community. So we have a really intensive team that works with those individuals to keep them out of not only law enforcement contact, but also an inpatient facility. So in 2025, we opened a outpatient clinic. That was kind of this expansion that we started saying we're going to open our doors to everyone. So anyone can come in, and that's individual therapy, that's family therapy. On the screen, you can see all of it. But this is really trying to do integrative care, meeting the social determinants of health for individuals. You know, we're trying to treat this from a holistic standpoint. People just don't come to us with their behavioral health challenges. They also come with some of their social challenges. So we want to make that linkage. So over the last 2 years since we've actually started the CCBHC, we've increased our numbers by almost 30%. Last year alone, we served 1,100 people. Again, we're trying to meet these individuals in the community where they're at. So whether it's we go to them, or they come to us, or they call into us, so we're really trying to meet that crisis in that moment, as opposed to them ending up in an emergency room. This is all able to try to hopefully prevent emergency room and jail use. So if we look at the actual clinic, we have been seeing about a 26% increase for children and for a 43% increase for, 26% increase for adults and 43% increase for children. You got to remember, we started and launched this program during the pandemic. So you really had to build this trust for the community to come in, because people didn't really want to come into to clinics during the pandemic. So we really reestablished our connection. If you go over to Fuller right now, you will see that building is actually completely packed all day long. We're actually looking to add a second facility down on Monroe Street because we just don't have any more space up on the county campus anymore. Probably this is the one that I've come here to talk the most about, is the two different sides of the crisis center down at Trinity Health. Our first year, we served 998 people in the urgent care, and then we served another almost 500 people in the CSU. This last year, we served 2,300, and this would be our first full year. So if you think about it from this perspective, in December of 2025 was the first month where we had all 16 beds open and the urgent care fully open. So we really now have a year's worth of real data. We served about 1,300 people in the urgent care, all of which we think would have ended up in an inpatient hospital. So we are moving to a less restrictive, clinically model to make sure that the individual is served briefly, and then we want to get them linked back to our CCBHC outpatient. Here are some demographic numbers of, we're really serving individuals 45 and under. And we hopefully, if we can catch them that early, then they're going to be on the road to recovery. And the demographics and ethnicity are reflective of Kent County. And this is really reflective of the Kent County Medicaid population. Over the next several years, as we expand the CCBHC, these numbers will become more reflective of the whole county because we'll be serving the entire county as opposed to just serving the Medicaid population. These are our top services for 2025. As you can see, these run the gamut of between what we call the specialty plan, which are the services that are paid for by Lakeshore Regional Entity, and then those CCBHC services. And I'm happy to take any questions.
Thank you, Bill. Appreciate that overview.
Yep.
And appreciate all your work you do.
Thank you.
Impacting a lot of people in this county. So Commissioner Boujak.
Thank you, Chair. Bill, this is one of those presentations where when we see an increase, it's not troubling. And I think seeing the increase of the services that you've been providing and the number of people that are receiving those services is a blessing. And I've been very intrigued by Network 180 as an elected official, having been watching it develop and grow, and now actually be ready to serve the community in its full capacity. And it's just such a necessary function. This is one of those government functions that makes sense. And a model. I've heard many commissioners when I go to conferences throughout the country that have heard of our Network 180 and are looking at our program and want to model after it. So kudos to Kent County for developing this program and for making it a model worthy of all other counties in the state of Michigan, and also in the eye of counties throughout the country. So congratulations to you and your team, and hope that the county can continue to work with you, with financial support. And again, I really appreciate what you do for the families that need these services. Thank you.
Thanks, Commissioner.
Commissioner LeGrand.
Thank you, Chair. I just want everyone to realize, as someone who serves on the board of Network 180, he could have told you so much more. That was really brief. So just two kind of clarifying things. On the maybe one slide previous where you had the top 10, yeah.
Yep.
So does the brief intervention clinic, is that the one at the crisis stabilization unit?
Yeah, that's the front area,
That's the front
Commissioner
area,
LeGrand,
yeah.
where we try to, so when an individual comes into the crisis center, they can come in one of two ways. The back is our law enforcement drop-off, so that's for police, and actually now it's ambulance as well. And the front is what we call our urgent care. They're gonna go in there, they're gonna be immediately triaged, and we're gonna determine whether we can resolve their crisis within, let's say, 4 hours, or are they gonna be longer than 24 hours. If they're longer than 24 hours, then they will admit them back into the secured facility. Our average timeline in the brief intervention is about an hour and a half now. It started off as 4 hours, but now we've gotten it down to about an hour and a half.
Wow, okay. So that is like our number 2 service, wow. That's amazing.
Yeah, and then the idea is now to get these individuals then enrolled in the CCBHC, so they don't have to come back.
Right.
One of the things that we're not seeing is recidivism rates. So if you look at the recidivism rates for the CSU and brief intervention, it's about 4%. So that means someone is not coming back to us almost 96% of the time, within 30 days. Inpatient is even lower now. Now inpatient's about 1.5%. So the other thing, to your point, Commissioner, we have gotten credibility with the community. So now we're getting more people that we've never seen before in our entire life. So I think we've knocked down some of the barriers of the stigma, and people are willing to come in. You know, we have been, from our customer service surveys, people like coming to the crisis center because they think it's a welcoming environment where they can be free to actually deal with their crisis moment.
Great. And then one other quick question. You talked about the CCBHC money coming from the state. It is a federal program?
It's a
so
federal match, yeah.
It's a federal match.
You
Okay.
asked me that question last night, and I don't have the answer to it yet.
Oh.
You asked me what the actual match breakdown was.
Oh, okay. Okay. Anyway, thank you so much for explaining all that. It's so much like the DVAN work in that we're preventing the recidivism and the escalation and the much more expensive, either, incarceration or inpatient stays. And so it's difficult to track that money, but it's still money. And so it's a big savings for the
Well, I
community.
can tell you right now, we know from Corewell's data that their behavioral health episodes at Butterworth are down almost 20%
Wow.
because they're coming to us now
Okay. And is that instead of through their ER?
instead of being at Butterworth's ER.
Wow. Wonderful. Great. Thank you. Thanks,
Yep.
Chair.
Thank you, Commissioner Morales.
Thank you, Chair. I saw that you help out individuals as young as 3 years old, and I'm just curious about how are children referred to you? Because I've called Network 180 before on behalf of other people, and I know that they usually have to provide consent, so I was just kind of curious about what that looked like mechanically.
Yeah, so that's what we have our access intake center. And so an individual would call in and then we would make an appointment for an intake. And we can actually work with families as young as pregnant mothers. There's something called the Infant Mental Health Program, which is actually you're working with a mom before the child is actually born. So it really is, you'll come in, you'll do your assessment, and then we will determine what services that you qualify for, what services you need. Mhm. And that's why, if you look at the number one on the top, that's what the Access Center does.
Okay.
So they're the ones that you're calling into on your day-to-day.
Follow-up to my question is, do they ever get referred in from schools, or is it usually through family members?
Oh, yeah, we have partnerships with KSSN.
Okay.
And so most of the KSSN providers are also Network 180 providers. One of the slides I kind of skipped over was, we serve uniquely about 16,000 individuals in Kent County. About 10,000 of them are served by Network 180 directly, and about 10,000 of them are served by our 200 or so provider network.
I see.
So, and you can cross over. You can have services from a private provider as well as from Network 180. So that's why those numbers don't add up.
I see. Thank you.
Great, thank you. I don't see any more questions. Thank you, Bill. Appreciate all the work you do. It's important work in Kent County, so keep it up.
Thank you, Commissioners.
Thank you. Okay, we'll move on to item number 5 on the agenda, which is our agenda items. We do have one, item 5A, which is recommendation of appointments to various boards, commissions, and committees. You'll see the summary document is in your packet. I did want to thank the committee for taking on this project. It's important work, and we divided the committee into teams. We had, there were 55 vacancies. We had almost 200 applications that this committee vetted and screened, and did interviews and made recommendations. So appreciate that important work. We have a lot of community members stepping up and wanting to serve, donate their time and resources to support the work of the county. So appreciate that. So you'll see the summary document. Any questions from committee members? Okay, I'll entertain a motion to adopt. Okay, moved by Commissioner Bujak to move action item 5A.
I'd like to make a motion that we approve Agenda 5A, Board Office Appointments to various boards, commissions, and committees.
Thank you for formalizing that, Commissioner Bujak, supported by Commissioner LeGrand. Any discussion? Seeing none, all those in favor? Yes, Commissioner Bujak.
Oh, Mike's on. Thank you, Chair. Of all the work that we do as commissioners here, for Kent County. This is probably the most difficult assignment that commissioners are tasked with. There are hundreds and hundreds of applications and hundreds of resumes that we have to go through. And I just wanted to thank staff for doing such a great job of putting together that information for us. I've been involved in this process now several years, and this year, the organization of the information that was put forward to us was such that it made it much easier. So evidently, we're learning how to improve our processes, and I wanted to thank staff for their involvement in making those process improvements. We are blessed with getting hundreds of applicants coming to the county and asking to volunteer to be part of this and part of the county's commissions and programs. And going through all those resumes and trying to find the best candidates is a very, very difficult assignment. In many cases, we will have several candidates that are qualified and after going through the difficult interviewing processes, we have to make a difficult decision as to which candidates we feel are the best. And I just want to encourage candidates that are out there that may be watching this. I just want to let them know that we do thoroughly vet every candidate, and we do look at their resumes, and we do read all the information that they send to us in their letters, and we do take seriously the review of all that information. And I encourage them that even if they didn't get selected for these committees, that they continue to offer their services, their talents, their expertise, and give us that opportunity to help find a place. I wish we could find a committee for everybody that wants to be, a part of this county. We are a wonderful county, and thanks to all these wonderful volunteers that put forward their willingness to serve, we have great committees and commissions. So again, thank you to the commissioners that are involved in this process, staff that put together information, and the volunteers from the county. We have a great program, and I'm privileged to be a part of it.
Thank you, Commissioner Bujak. Any other discussion? We have a motion on the table. All those in favor, please say aye.
Aye.
Any opposed, say nay. All right, motion is approved. Agenda item 5A is adopted, and we'll go to the full board for our January 8th meeting for consideration. Okay, we'll move on to item number 6, which is miscellaneous. Any commissioner have any miscellaneous items for discussion? Commissioner Bujak, you're having a busy morning this morning.
I'm feeling very, my coffee must have really kicked in this morning. I did want to make an additional comment about the domestic violence problem in our society. I mentioned that we need to try to better understand the root cause, and truly the root cause of the problems that we see in domestic violence are the decline of the family and family values. And there was one man, and Jesus is the reason for the season, who did bring forward a concept. And I think love is what the ultimate solution is. People need to figure out how to love better, and they need to follow the gospel of love that Jesus Christ brought forward for all of us. So just my opinion, but I appreciate what the government's trying to do and the programs that we have, certainly very necessary, but people need to look into their own hearts and find their faith.
Thank you, Commissioner Bujak. I just also want to say I think 2025 was a great year. I enjoy serving on this committee. This is a brand-new committee. Enjoy serving with all of you on this committee. We have a lot to look forward to in 2026. One of the things is we're not up for election in 2026. So that's something to be thankful for. We have 4-year terms now, but it will be an important election year in 2026. So I'm sure we'll be all involved in that in some capacity. But with that, I wish everybody Merry Christmas, Happy Holidays, and we will see you on January 8th for our first board meeting of 2026. So seeing no further business, I will entertain a motion to adjourn. Moved by Commissioner LeGrand, supported by Commissioner Morales. All those in favor, please say aye. Aye. Any opposed, say nay. We are adjourned.